My name is Khabazane Kwadiba. I'm going to be presenting to you on the title, Targeting Multiple Risk Factors Reduces the Chances of Getting Macrovascular or Cardiovascular Disease Better Than Lowering Blood Sugar Alone in Type 2 Diabetes. First, I will define the terms in that title. The first term is diabetes. This is a condition whereby your body fails to properly control your blood sugar. The second term, type 2 diabetes. Type 2 diabetes is a subset of diabetes and is the most prevalent diabetes type, affecting about 90% of diabetes patients. In type 2 diabetes, your body fails to efficiently use a chemical or a hormone called insulin, and we call that insulin resistance. Insulin resistance is usually accompanied by an overall shortage of insulin in the body, even though sometimes insulin may be at normal concentration, especially in the beginning of diabetes. You may be asking yourself, what is insulin? Think of insulin as a key that your body parts that uses blood sugar need in order for blood sugar to enter into those body parts. Just like your house, if you don't have key, you cannot enter, and in the same manner, these body parts, they need insulin as the key to unlock them in order for blood sugar to enter. The next term is macrovascular or cardiovascular disease. These are diseases of the large vessels of the heart, the brain, and the large vessels that supply your feet and legs with blood. And if your heart vessels are affected, you get heart disease, including heart attacks. If it's in the brain, you get strokes. If those blood vessels that supply your feet and legs are affected, you get peripheral vascular disease, whereby those blood vessels get narrow and may even be blocked. And the last one is the risk factors that increases your chances of getting macrovascular disease. Those are conditions or bad habits that increases your chance of getting macrovascular disease. And this can be in two categories: modifiable, that means the ones you have control over, versus non-modifiable, the ones that you don't have control over. Now I'll start with non-modifiable risk factors. These are things like age. As you get older, your chances of getting macrovascular disease increases. Or things like family history of getting cardiovascular disease at an earlier age. Now, those we don't have control over. So now I'll concentrate on the ones that we have control over, the modifiable ones. Example is diabetes itself, especially if the blood sugar is uncontrolled. The second example is high blood pressure. In high blood pressure, your heart have to pump harder in order to push the blood through those blood vessels that are exposed to high blood pressure. And that puts a strain on the heart. And even the blood, those blood vessels can actually be damaged with time. The other risk factor is the blood lipids, or blood fats, or cholesterol. If it is high, it increases the risk of getting macrovascular disease, because those fats get deposited inside the blood vessels and they accumulate with time, narrowing those blood vessels and leading to those macrovascular disease complications. And the other one would be smoking. Smoking increases your chance of getting macrovascular disease, and so on and so on. So as I said, diabetes is a risk factor, and in fact people with type 2 diabetes, they have a higher chance of getting macrovascular disease than people without diabetes. So as a result, over the years, studies were done to see or to come up with ways of reducing macrovascular disease in patients with type 2 diabetes. And the first set of studies, they lowered blood sugar as low as possible as a strategy of reducing cardiovascular disease, while other studies actually looked at multiple risk factors, including diabetes itself, or including lowering blood sugar, to see if that strategy can reduce these complications better than reducing blood sugar alone. I'll start with reducing blood sugar. One particular study called ACCORD actually reduced, or it aimed at reducing the blood sugar levels to the levels of people without diabetes. And what they found was that the strategy does not reduce the chances of getting macrovascular disease, but instead it increased mortality or death in those patients. And actually the reasons why death increased are still unexplained to this day, or they are a subject of speculation. Now, what do we learn from the ACCORD and other related studies? When it comes to lowering blood sugar, individualized blood targets. All people are different. You cannot target blood sugar to the same levels for different people. For example, a younger patient, 40 years, just diagnosed, no complications yet, you can try to lower the blood sugar as low as possible. But somebody 90 years old, they've been having diabetes for years, lot of complications. If you try that strategy, you may actually increase their death without accomplishing anything as far as reducing the macrovascular complications. Now, what should we do if this strategy doesn't work? The other studies, or a study called STENO2 in particular, used another strategy of targeting multiple risk factors, including lowering blood sugar, and they found that that strategy works better at reducing these complications. In that study, even though only 15% of patients they got their blood sugar targets, the researchers found that they were able to reduce the risk of macrovascular complications significantly. What do we learn from this? If you target multiple risk factors, including lowering blood sugar, you will have a better chance of reducing macrovascular disease significantly than targeting blood sugar alone. So what is your take-home message? Talk to your doctor. Talk to your healthcare professionals that accompanies you in this diabetic journey, that are accompanying you in this diabetic journey. And together you can come up with strategies of lowering these multiple risk factors in order to lower your chances of getting macrovascular disease. Thank you.